When an individual faces social isolation or rejection, the receptors in the brain that are targeted are the exact same receptors that are targeted by physical trauma or physical abuse. There have been many studies that show how social ties and meaningful relationships can act as buffers against many mental health issues like depression. One of the populations that faces extreme social isolation is the Lgbtq or queer community. Studies show that nearly 45% of the Lgbtq youth are facing homelessness as a result of family rejection or rejection by their community, and the rates of suicide among this population are 4 times higher than the rates of the heterosexual populations. As healthcare workers, it's crucial that we welcome this community with open arms and hearts, providing the support that they need to thrive and live healthy lifestyles. Still, 1 in 5 health practitioners will turn away patients who are openly queer, and 53.8% of healthcare providers felt as though they were not adequately educated in this population's health needs. This was according to a study done by the Journal of Clinical Medicine. Health disparities among the queer community are increased in number, partly due to social stigmas and the fear of rejection by healthcare providers. This ultimately creates a barrier between these individuals and their reception of healthcare. Some things that are important to note are that LGBTQ individuals are at an increased risk for things like depression, anxiety, substance abuse, and obesity, all risk factors for cancer. There are also 7 cancer sites that affect this community disproportionately. These are anal, breast, cervical, colorectal, endometrial, lung, and prostate cancers. It's important that we educate healthcare providers, patients, schools, and youth about the risk factors that are associated with the LGBTQ lifestyles, signs and behavioral patterns to look out for, and how to create safe and healthy lifestyles among this population.